I'm Dr. Judson Brandeis, a board-certified urologist and Hive 80 medical advisor, talking to you today about what to do if you get COVID-19 to prevent your COVID illness from becoming more severe. I will reveal 6 simple steps to avoid COVID complications, and then I'll explain the rationale behind them. The first piece of advice is to take an adult aspirin, 325 milligrams, every day. A recent study at the University of Maryland demonstrated that a daily aspirin lowered the risk of ICU admission, the need for a ventilator, and the risk of dying. Stay hydrated. Drink an 8-ounce glass of clear fluids every hour. It doesn't matter whether it's water, a sports drink with electrolytes, or Pedialyte. You will know that you're properly hydrated because your urine should look a light straw color when you go to the bathroom. Take a citrulline-based nitric oxide booster like Affirm from Affirm Science, which supports protective levels of nitric oxide in the body. You need to take 2 tablets or at least 1.5 grams of L-citrulline twice a day. There have been multiple studies using inhaled nitric oxide to treat severely ill COVID patients, but inhaled nitric oxide is only appropriate in the hospital. Citrulline-based supplements like Affirm create nitric oxide in the bloodstream, which protects arteries and veins. Take 2,000 units of vitamin D every day. The medical community is divided on this recommendation because the way that vitamin D boosts immunity is complex. However, the risk of taking extra vitamin D is minimal. Deep breathing exercises. Breathe in through your nose and pull air down into your stomach. Expand your chest at the same time. Slowly exhale completely through the nose, emptying your lungs, and then repeat your deep breaths 10 times. Finally, toe raises. Once an hour, stand and then raise up on your toes, and then roll back onto your heels, and then back to flat. Repeat this 10 times. To summarize, every day, take 1 daily adult aspirin and 2,000 units of vitamin D and 2 Affirm nitric oxide booster tablets twice a day. Every hour, drink a glass of water. Perform 2 minutes of deep breathing exercises and do 10 toe raises. Okay, now I'm going to explain the science behind why you need to do these 6 things. The greatest harm from COVID occurs by clogging blood vessels. Italian doctors published the first study looking at the lungs of COVID patients who had died and found 10 times as many small blood clots in the lungs of those who died compared to those who died of a typical pneumonia. In the lungs of COVID patients, they also noticed severe damage to the endothelium, the delicate inner lining of blood vessels. Observations by the Italian doctors were the first clue scientists had that COVID was a disease of blood vessels rather than simply of the lungs. The endothelium lines the inside of the arteries and veins throughout the entire body. When COVID attacks the endothelium, the immune system mounts a massive response against COVID, referred to as a cytokine storm. In the process, the immune response causes damage to these important but delicate cells. The inflammation leads to a narrowing of small arteries throughout the body. Damage to the endothelium also leads to blood clots in the arteries. Now, if you have an artery serving the brain that gets clogged, that can cause a stroke. If the coronary arteries are blocked, that can result in a heart attack. A sad example of this is Congressman-elect Luke Letlow, who is 41 years old and healthy. A week after he contracted COVID, he died of a heart attack. COVID patients also tend to develop blockages of small blood vessels in the legs, resulting in a condition referred to as COVID toes, and the penis leading to erectile dysfunction. I've posted a video on YouTube explaining how COVID causes erectile dysfunction. Just search for BrandeisMD on YouTube for more details. So to recap my recommendations: 1, aspirin reduces your risk of clots by preventing platelets from sticking to each other. 2, drinking a lot of fluids is a healthy way to dilute the blood. reducing your risk of blood clots. 3. Citrulline supplements produce nitric oxide, which protects the endothelium from damage. 4. Vitamin D boosts the immune system. 5. Foot exercises improve circulation in the legs and reduce the risk of deep venous thrombosis. And finally, deep breathing exercises enhance oxygenation and blood circulation in the lung. Listen, COVID can be a deadly disease, but there are things that you can do to reduce your risk of severe illness and long-term consequences. Follow us at Hive 80 for more advice on COVID and other important health and wellness topics. I'm Dr. Judson Brandeis, coming to you from Hive 80. We wish you all the best in health for 2021.